Hello friends, welcome back to my YouTube channel ICU Corner. So today we are going to discuss about new topic ARDS, that is acute respiratory distress syndrome. Very commonly admitted patients in the ICU. Uh, so basically, what is ARDS? ARDS is a life-threatening condition that is characterized by inflammation and damage to the lungs, leading to impaired gas exchange and respiratory failure. It's often caused by direct lung injury, example pneumonia, aspiration, or indirect lung injury, that is through trauma or sepsis. So you see here the X-ray of ARDS patient, which has a diffuse infiltrates on a bilateral in the bilateral lungs. So, friends, what are the causes and risk factors? There are two types of causes: direct lung injury and indirect lung injury. Direct lung injury includes pneumonia, aspiration, inhalation injury, or near drowning. Indirect one, the patient which is admitted with any kind of infection in a sepsis or for the trauma, pancreatitis, or massive transfusions can also ultimately uh, leads into ARDS. Other risk factors are old age patients, underlying lung disease such as bronchial asthma, COPD, or certain medical conditions. What are the clinical presentations? ARDS is basically has acute onset. The symptoms develops rapidly, often within hours or days. There is a respiratory distress, complaints of shortness of breath, tachypnea, and hypoxemia. Chest imaging suggests of bilateral infiltrates, as we see in previous slide, infiltrates on the X-ray or CT scan. What is the pathophysiology of ARDS? There is inflammation and damage, activation of inflammatory cells and release of cytokines leading to lung damage. There is increased permeability, fluid and protein leak into alveoli, impairing the gas exchange. So what happens basically, any bacterial infection which is already present in the body, the patient is in sepsis, that leads to activation of the inflammatory cells, and that damages the lungs, alveoli, cells of the alveoli, and there appears increased permeability to the fluids, and the alveoli gets filled with the fluids, and ultimately leading to the impaired gas exchange, that is reduced oxygenation and impaired carbon dioxide levels. So basically in ARDS patients we get raised PCO2 levels. They are also called as type 2 respiratory failure. Berlin's definition we see based on the Berlin's definition, ARDS is defined as acute onset within hours and days, bilateral infiltrates, respiratory failure, which is not fully explained by cardiac failure or volume overload. So basically, friends, in ARDS patients, we do 2D echo of the patient, which is normal, which has a normal study, and ECG and NT-proBNP test, which also presents a normal value, but still there is a volume overload in the patient, which is not fully explained by the cardiac failure. Severity classified as mild, moderate, or severe based on oxygenation levels. So there is a formula. We usually do ABGs in the ARDS patients. From that, we calculate PaO2 divided by FiO2, which is the patient is on ventilator support, how much FiO2 requirement is there, and if the value comes below T300, it is diagnosed as ARDS patient. What is the management? Basically, the ARDS patient most likely requires some mechanical ventilation support to maintain the adequate oxygenation. With mechanical ventilation support, we have to give low tidal volumes to minimize the lung injury, because already the alveoli are filled with the fluids, and tidal volume can further damage the situation. The PEEP the PEEP is given to improve the oxygenation. Fluid management, we have to give very carefully the fluid administration to avoid volume overload. Treating the underlying causes, when the patient is in sepsis, we have to treat it with higher antibiotics. If there is a trauma, any underlying cause, we have to treat first, which will help to improve the prognosis of ARDS. Complications. There is a respiratory failure. Patient may require prolonged mechanical ventilation and is a potential need of ECMO. There may be MODS, that is multi-organ dysfunction. If there is worsening of the case in the ARDS, that can lead to failure of the other organs such as kidneys, liver. Patient may require hemodialysis and prolonged ventilation support. Long-term consequences. Survivors may experience persistent respiratory symptoms. Ultimately, if the ARDS patients get recovered, their lungs get fibrosed, and they may experience a persistent respiratory symptoms, muscle weakness, and psychological distress. Thank you, friends. Please like, share, and subscribe my YouTube channel, ICU Corner. See you in the next video. Till then, goodbye. Take care.